This course will teach you to perform a basic assessment of your child's movement quality, a key risk factor for ACL injury. It will also give you a better idea if they are moving as efficiently as possible. Being a parent is no easy job. Making sure that your child is safe, healthy, and happy is a constant challenge. While 30% of ACL injuries are due to physical contact and are difficult to avoid, 70% are non-contact in nature and are related to poor movement skills. These injuries happen because an athlete doesn't perform a jump, landing, deceleration, or change of direction properly and puts an overwhelming amount of stress on the ACL. Assessing your child's movement quality will allow you to keep tabs on them, making sure they are moving in a way that is safe and efficient when playing sports. This assessment is called the 3-point inspection. During the 3-point inspection, you will look at your child's ability to maintain proper alignment and stabilize their upper, middle, and lower body during physical activity. If you identify that your child demonstrates poor movement quality, speak to their coach, PE teacher, physical therapist, or doctor about your concerns. This information will allow these professionals to help improve your child's movement quality. To begin this activity, take a few pictures or record videos of your child when they are playing sports or being physically active. Ideally, these images should be taken from different angles, from the front and from the side. If you already have pictures or videos, you are ready to get started. The first part of the 3-point inspection looks at the upper body. Our heads weigh around 10 or 11 pounds and are positioned well above our center of gravity. It is important that athletes stabilize their upper body in a neutral position when playing sports. When an athlete's upper body is not stabilized in a neutral position when playing sports, extra movement in their head can cause their body to move around with less control. It is easiest to assess the alignment of your child's upper body when looking at a picture taken from the side. To assess the alignment of the upper body, the ear, shoulder, and hip should be in a straight line. Whether your child is performing a plank, jumping, or decelerating, these 3 landmarks should always be aligned. Take a look at these 2 pictures. In the picture on the left, this athlete's ear, shoulder, and hip are perfectly aligned. In the picture on the right, these 3 landmarks do not line up. The second part of the 3-point inspection will look at the middle of your child's body. The muscles of the core are designed to provide stability in every direction around the center of the body. To check for alignment in the middle of the body, we look for tilt in the pelvis. Having a tilted pelvis can make it difficult for your child to maintain their balance and control their body when playing sports. Let's start by looking at an athlete in a neutral position. The middle of this athlete's body is aligned properly. The muscles of his core should stabilize him in this position. Now, let's look at the different deviations from a neutral position. In this first example, you can see that from one angle, he looks neutral. However, from the side, you can see that his pelvis is tilted forward, and as a result, his spine is not in a neutral position. In this picture, the athlete is balancing on one foot. In the first picture, she is able to maintain her balance easily with the middle of her body aligned properly. However, in this second picture, her hips are tilted to the side. As you evaluate the position of the middle of your child's body, it is important that you look from multiple angles to see deviations from a neutral position. The final part of the 3-point inspection addresses your child's alignment of their lower body. Take a look at the picture in the middle of the screen. Notice that on this athlete's front leg, his hip, knee, and ankle all are positioned in the same line. In the pictures on the left and right, you can see that his knee is rotated out and in respectively. The ligaments in the knee are under tremendous pressure as they prevent his knee from rotating any further. In the picture on the right, the ACL is one of the ligaments that is playing a role in keeping the knee as stable as possible despite this compromised position. When moving at fast speeds, being in this position will put a lot more stress on the ligaments than when standing still or moving slowly. In this case, that extra stress can cause the ligaments, like the ACL, to tear. Many athletes who have torn their ACL had their knees in this exact position when the tear occurred. Being fast is important. However, being fast and moving correctly is more important. Imagine that this picture was taken as a force was being applied to the outside of the knee. This force could be from an opponent trying to tackle him or from an awkward jump or landing. Sometimes these forces can be incredibly strong and can push the ACL beyond its limits. In this case, the ligament is torn and the athlete suffers a devastating injury. An athlete's ability to keep their lower body in a neutral and stable position will improve their movement quality and can help reduce the risk of ACL injury. Now that you have learned all 3 points of the 3-point inspection, let's practice evaluating a few different athletes. Remember that in order to perform a complete assessment of the alignment of the upper, middle, and lower body, you will need pictures of your child from a variety of angles. In pictures taken from the front, you'll be able to assess the alignment of the lower and part of the middle body, while pictures taken from the side will provide insight into the rest of the middle body and the upper body. Let's begin with this picture of a girls' high school volleyball match. We are going to focus on number 33. Even though she is not in the middle of the action, we are getting a great idea of her movement quality. Because this picture was taken from the front, we will be able to evaluate the alignment of her middle and lower body. Her pelvis seems to be neutral, not tilted to one side or the other, and we can determine that the middle of her body is properly aligned. When it comes to her lower body, it is evident that her knees are rotated inwards and that her hips, knees, and ankles don't form a straight line. Therefore, she would not pass the inspection from this angle. Let's look at one more picture taken from the front. This picture was taken as this young athlete stopped herself after running full speed. The horizontal line running from one hip to the other is a good indicator that the middle of her body is in a neutral position. Her hips, knees, and ankles are also properly aligned. No matter what sport your child plays, it is important for them to be able to stabilize themselves in a neutral athletic position, just like she does here. Now, let's take a look at some pictures taken from a different perspective. Remember, when a picture is taken from the side, we can only evaluate the alignment of the upper and middle body. To assess the alignment of the upper body, we want to ensure that an athlete's head and neck are in a straight line with their back. To make this simple, we just need to look at 3 parts of their body: their ear, shoulder, and hip. If those 3 parts of their body form a straight line, we know their spine is straight. In this picture, the boy's ear, shoulder, and hip do not form a straight line. He is putting his neck under pressure by bending his head upward in this fashion. Now, let's look at the middle of his body. Even to the untrained eye, it is easy to tell that his back is arched. In this case, his pelvis is tilted backwards and the middle of his body is not properly aligned. Let's have a look at one more picture. This gymnast is practicing jumping and landing with her team. Her ear, shoulder, and hip all form a perfectly straight line, demonstrating the excellent alignment of her upper body. The middle of her body is also perfectly aligned. Notice that her back is neither arched forward nor backward, but is neutrally positioned instead. After practicing a few times, you can assess a picture rather quickly. Movement quality always matters, whether they are playing sports, exercising, or lifting a heavy textbook. Continue to use this tool to make sure your child is always moving safely. Now that you properly know how to perform a 3-point inspection, practice with some pictures of your child. After evaluating your child, if you notice that he or she is consistently struggling to align their body, consult with a trained medical professional. Please visit our website to learn more about our program. There you will find more resources to share with your children, their coaches, and other parents. You can also share our free course for coaches with your child's coach. This course teaches coaches how to lead a neurodynamic warm-up. The neurodynamic warm-up was designed to replace outdated and ineffective warm-ups and will help improve your child's movement quality and reduce their risk of injury. On the next page is a guide for you to use when assessing your child. Scroll to the bottom of the page and open the PDF file. Thank you for completing this course and for your commitment to keeping young athletes safe and healthy.